that is being used, which is causing the cervical spondylosis. That is nothing but atiyogam, or excessive usage of gadgets or excessive usage of that particular part of the body which is causing the problem. And erratic behavior of time. See, right now we are getting too many cases of upper respiratory infection, cough, allergic rhinitis. Why? Because right now that the climate is supposed to be kind of a summer getting into a rainy season stage, but we are getting extreme differences. Daytime it is very hot, and evening it is raining too much. So what happens is this erratic behavior of time or season is going to cause changes in the body, also resulting in certain health conditions. And added to that, if people don't stick on to proper diet recommendation said in the textbook, usually when a man eats according to his digestive power, eats lukewarm food, eats slightly oily food, he is not bound to get any disease if he follows this particular simple rule throughout his life. But it is not so every time. He deviates from it. And then, of course, there is something called as ethical living or dharmic living, which is said in the textbook, which is also a cause of disease. We call as prajnaparada. So, if the same mistake in an individual is happening on a large scale, if people in a particular area do the same mistake or do the same activity which is not conducive to their health, then that will result in endemic problems, or sometimes it can lead to communicable diseases in that area also. So coming to our main topic today, how a disease can become chronic. Most common reason in clinical practice we find is that the disease goes unnoticed or undiagnosed, or even if it is diagnosed, it is not attended, and above all, if it is ignored, it can lead to a chronicity situation. And then, in spite of having the problem, the person continues to expose to the cause. We find so many diabetic patients not controlling the diabetes because still they continue to take sweets and all that stuff, too much of rice-based diet, raw rice-based diet. And then this the third reason, if the deranged dosha, which means the defective bioenergy in the body, vata, pitta, kapha, the same diabetes example, if the person is not treated in a proper manner, given, if not approached in a proper manner, then if it is not rectified completely also, it will stay for long. And we find this a very relevant reason for people getting repeated allergic skin manifestations like allergic urticaria or allergic dermatitis. All these people, if the treatment done is not complete, if the purification or the shodhana, we say, they are given purgative or some kind of treatment to remove the toxins, detoxification, a popular word these days. If that is not done properly, then it will come again and again. So that is an important reason. Choice of drug or treatment modality is wrong or insufficient. So the drug may not be sufficient to handle that situation. That can result in the problem continuing for longer duration. And then, in spite of all this, if the disease or the strength of the disease is such that it cannot be challenged by any means. This recently we find that the COVID patients, if the first wave, I think the first wave and the second wave rather was very strong, and people who had comorbidities in the first wave had problem, whereas in the second wave, even people without comorbidities developed very severe respiratory crisis, and they went into coma, and unfortunate events happened for even younger generation people. All this because of the nature of the disease, and it remained unchallenged in those patients. Okay, in spite of all the above reasons being taken care of, if the disease is stubborn, then we say it as karma, but still we cannot wash our hands saying that we don't treat it. We can reduce the severity of the disease, or at least we can give some strength to the patient by doing some logical treatment. So among these 6 points, the fourth and sixth are highlighted in green. So why? Because it is our area of interest, particularly in our association. So here, the choice of the drug or treatment modality, that is our important target area. And then even in diseases which are stubborn, we have to find ways to give better relief to the patient to improve the quality of life. So these are the chronic diseases which I have listed out here. Very popular. It is very popularly known that Ayurveda can treat osteoarthritis. So I have kept it as a heading in the top. And the other diseases which we are managing to our known circle and in our colleagues which we discuss, with whom we discuss frequently. So these are the conditions which we treat, and we get good result also. So headache, migraine headache, vascular headaches, we get very good result. Sinus headaches, tension headaches, but headaches like trigeminal neuralgia, these things happen repeatedly, and the intensity of pain is also severe. We are able to treat a few patients, but the results are mixed. But there is a lot of scope to do research in that. And then irritable bowel syndrome is a very strong area. Colitis, ulcerative colitis. Crohn's disease, slightly challenging, but colitis is much easier, much simpler way to treat than Crohn's disease. Irritable bowel syndrome, of course, the success rate is very good. And then respiratory system, rhinitis, allergic rhinitis or non-allergic rhinitis, allergic bronchitis, allergic asthma. So these conditions we can treat, but when it is a COPD or a chronic bronchial asthma patient, we are able to do some supportive care for them in terms of reducing their, improving their overall strength and physical endurance. And then in cardiovascular system, of course, you know about the kind of market is there for herbal supplements for preventive health. But as Ayurvedic doctors, we treat the condition based on the prakriti, the presentation of the cardiovascular problem if it has already happened. But if somebody asks for a preventive option, it is not necessary that we have to give only heart-specific medicine. There again, the dosha analysis comes into play, where we can give something else. Even a digestive medicine can act as a preventive medicine for heart disease. And then supportive medicine for people who are already under cardiovascular drugs, who are already taking blood thinners. There we can do supportive treatment for other non-cardiac symptoms, as well as improve the cardiac muscle strength by giving some specific rasayanas, or rasayana means regenerative medicines. And in gastroenterology, the indigestion is very commonly known that we can treat colic, indigestion, bloating, and then ulcers, very good success rate. Hepatology is a very huge spectrum. Still, we can say that certain types of hepatitis can be treated with good Ayurvedic prescription. Gallstones, it is on the rise these days, basically because of snacking habit. So these things are also coming more to the patients through our clinic these days. Gynecology is another strong area. PCOD, polycystic ovarian disease, menorrhagia, fibroid uterus in the if it is in the much earlier stage, if the patient is not into the absolute surgery indication stage, there all we can give very good result. Neurology, of course, patients who have faced a recent attack of stroke, once the patient is out of the initial crisis, then for recovery, for improving their movements, and then getting back to normal within, if the patient comes within a year, then definitely the treatment is much promising. Vertigo cases, as said before, because of use of mobiles, also cervicogenic vertigo cases are more. Apart from that, this benign paroxysmal positional vertigo is also there. And then migraine vertigo cases are also we are getting. So these are also giving good results. Ayurvedic medicines are giving very good results for these conditions. And then coming to immune system, this autoimmune spectrum is again a big area. We find diseases ranging from psoriasis, even IBS, irritable bowel is considered as an autoimmune disease. And then rheumatoid arthritis, various mixed connective tissue disorders, and then allergic skin manifestations like urticaria. But to give a hint about how effective autoimmune diseases are individual centric, to be frank. We cannot generalize that the diseases are curable in Ayurveda, at least to whatever we have seen so far. Individuals, prakriti, individuals' constitution, individuals' lifestyle, the diet, then the disease intensity, the duration of the disease, all these things come into play. But in spite of all this, we can say that the factors responsible for autoimmune disease, they can be managed through Ayurvedic treatment modalities, which include both palliative, that is Shamana Chikitsa, medicines, internal medicines in OPD, as well as admission in IP through some Panchakarma procedures. Allergic urticaria we can treat very well. It's a very good success rate for that. And then certain types of infections, some skin infections, we can treat very well. So lifestyle disorders is hot and happening topic today. So in this case, obesity, it's a challenge for any system. So we give medicines, but medicine's role, to my knowledge, is only 30 to 40%. Remaining 60% lies in the patient's discipline and adherence to instructions about diet or exercise habits. Diabetes, again, it's a big ocean, but diabetes, the associated symptoms of diabetes, the complications of diabetes can be prevented through proper Ayurvedic prescription, centered around the patient's prakriti as well. And then stress management, we all know we have Ayurvedic therapies as well, and also medicines which are useful. People know ashwagandha is very popular for stress, but there are other herbs which are equally popular. Even prakriti-based stress management is different. A person with a pitta constitution, he can be given a drug like Shankapushpi or Brahmi rather than ashwagandha if he is vulnerable to stress. Oncology or cancer disease and cancer spectrum, and then nephrology, these areas, specialized areas, the journey has just begun. So maybe in the days to come, we can talk about that more as we see more patients and able to give some result. So out of these 6 factors which we dealt before 2 slides. So this, the 4th one and 6th one, for this, what we need is textual research. The textual research, in the sense, a text, Ayurvedic text, contains about more than 100 formulations. For example, if you take a chapter on cough, there are about 100 formulations. It is one of the biggest chapters in Ayurvedic treatment section, where you find many formulations. But we need to identify which is good for the. It can be a single drug, it can be a formulation, a polyherbal formulation, or a herbomineral formulation. But we have to identify that through proper research. Now, how to choose that? How to make it more specific for whether it can be geography specific, it can be cost specific, or it can be age specific or lifestyle specific. Then these all need a lot of further analysis. As a clinician, when we see a patient with cough, if it is a child, the approach cannot be that strong. We have to be more calculative in a step. But again, there are some challenges there, which I will say towards the end. And then when it comes to an adult with a cough, then we can go for a much stronger formulation. The duration of treatment is also going to vary based on that. So field work here, the drug identification. When it comes to Ayurvedic practice, most of the Ayurvedic doctors, they buy medicines from manufacturers, reliable, credible manufacturers, and then they prescribe for the patients. So the drugs collected by the manufacturer is what being used for making the medicine. But in the drugs collected, if it is made on a large scale, there is a threat of the plant getting extinction, going to extinction stage. So to avoid all this, we need to document the right drug for is being selected, right species being selected. And secondly, in case of the species is not available, or it is going into an extinction stage, then we need to go for a alternative. We have abhavadravya, that means alternate medicine, alternate drug for particular plant. Suppose in, for example, in some formulations, we have this aconite, Vatsanabha we say, which is a very good analgesic. It's also used for a fever management in various herbal herbomineral combinations. So the replacement for that substitute is told as Ativisha. That is again Aconitum heterophyllum. The other one is Aconitum ferox. So there are substitutes like this. So following the textual guidelines. So in the text, the formula is being set. For example, there is a text. The text says this kashayam. So this kashayam dosage form, how it is prepared. In a large small scale setup, it is very easy. In the kitchen, it can be made. You prepare a coarse powder of the raw drugs after cleaning them or drying them, and then we prepare the kashayam. Whereas on large scale, we make in a huge boilers, we add preservatives, and then it is being packed. So we need to make a proper, what to say, the therapeutics mentioned in the textbook is very much interesting. If we see some of the formulations, we find that the therapeutics, the indications which are mentioned there, the properties mentioned there may not coincide. So I'll come to that in the next slide. but the effectiveness is still there. The mode of usage and the period of usage. Many formulations, there is no mention about how long it can be used, or how whether it is safe for usage in a pregnant woman, or it can be used for a long term. So these things we need to develop some more documentation. These things didn't happen earlier in those ages when the book was written, because the challenges were less. But now we have so many challenges: pollution, the strength of people is also coming down, the withstanding capacity to disease as well as the medicine, both are not like what it was before. So in this case, we need to add more information to the existing literature by doing a vast research in these aspects. Now, coming to drug discovery, what happens right now in Ayurvedic proprietary segment, proprietary market, is that so many drugs are being released. We find most of the companies adhering to 8 to 10 areas, starting from joint pain, skin disease, piles, then menorrhagia. So there is a template which is being followed. Rather, the approach has to be different. Now, understanding the need in the sense, not only need based on the disease, but also based on the convenience of usage of the medicine. We have a very common problem when it comes to administering a medicine to a child suffering from cough. The child has severe productive cough. We wanted to give a medicine which is a mix of an aristam. Aristam is a self-generated alcohol made using different herbs. And then we have to mix it with another polyherbal or herbo-mineral combination, gudiga, a pill. So this has to be powdered and then just mixed with the aristam and given. So here, the challenge is not the disease, but the challenge is the form of the medicine. Here, we need to find ways how this can mix well. Ultimately, what happens is only the liquid goes inside, the sediment is remaining inside the tumbler, which is the actual vati, the pill which we were powdering. So here again, these are all very small areas where we have to focus also when it comes to drug discovery. Of course, right now the Ayush department has developed various norms in bringing out a drug after establishing its safety, efficacy, and completing all the clinical trials. Okay, now coming to some basics about the drug. When it comes to whether it is a formulation or a single drug, we need to understand that 20 properties are the basic building blocks. So even whether it's a drug or the environment, an individual, a disease. As I said before, the disease called osteoporosis, there is a deficit of hardness, heaviness. So that has to be given in the form of medicine to bring it back to normal. So these are the 20 properties: heaviness, dullness, cold, chillness, oiliness, smoothness, solidity, softness, steadiness, subtle nature, clarity, and their opposites. So opposites are lightness, penetrative nature, heat, roughness or dryness, smoothness, opposite roughness, like that. So there are 20 properties. So these are the things which are described in the drug also. So when it comes to Ashwagandha, Ashwagandha is Ushna, Guru. Ushna means it is hot in potency. Guru means heavy to digest. So these are all explained in every plant. When it comes to plants, the Materia Medica which we use is Bhava Prakash Nigandu, which is very commonly used. It is a very big textbook containing the plants which are commonly used in practice and also their properties. So the properties, nothing but they will be containing the permutation combination of these 20 properties and maybe some 1 or 2 exceptions, additional properties as well. So example here is constipation. In constipation, there's a hard and dry bowel. So it is a Vata based problem, where Vata is also Parusha and Ruksha. It is also dry. So here we are treating that Vata by giving something warm, because Vata is also cold in nature. We're giving a warm, an ideal solution will be warm, oily and soft remedy, which eases the bowel movement and relieves constipation. Just to give a small information in the textbook, what the Acharya says that the taste is important as well as food is concerned, but when it comes to medicine, potency is very important. A medicine is understood by its potency. Potency in the sense, potency is what that decides the effectiveness, whether it is timely action or effectiveness in terms of relieving the symptom in a convincing manner. When it comes to a drug, Ayurveda says these properties: rasa, that is taste; guna, that is inherent nature; virya, that is potency; vipaka, that is post-digestive taste; prabhava, that is special behavior. This is a special attribute. And vichitra pratyavradha means an unexpected outcome. When something is sweet in taste and what to say, it is oily in nature, it is expected to be cold actually. But in case of a particular fish variety, it is sweet in taste, it is oily, but it is hot in potency. That is an exception. These things can happen. When in usual situation, in a normal situation, a combination of properties is expected to give a predictable outcome. But in sometimes if the outcome is a different, unexpected one, it is called as vichitra pratyavradha, unexpected outcome. Prabhava means if there are two drugs, for example, licorice, madhuka is eshti madhu, and then draksha. Draksha is your raisin. So both are sweet in taste, both are pitta reducing, both are oily in nature, but this has a special property, that is draksha, raisin has a special property of being a laxative. So these are examples. So when it comes to a plant or a drug, virium is very important, as I said before, hot or cold, that is the virium. Two types of potency, hot or cold. And then general property like heavy to digest or not, oily or dry nature. In Ayurveda, a very important aspect to understand a disease or a cause of disease, which is said in the textbook, is digestion, or Agni goes for a toss for any disease. So whether we give, not only when a person is taking food, even if it is a person is getting treated for a disease, he has to understand, the doctor has to understand whether the patient Agni or digestion is good. Based on that, he has to decide the treatment. Even medicines can be heavy to digest. So for a fever, straight away we cannot give a medicine. We all know this. Even grandmas tell that initially Langanam, fasting is important. Once slightly the Agni or digestion is regained, you can start giving medicine, kashayam or something like that. So a person, these are all examples of how Agni is important. So rasa, primary taste, the taste when the person's tongue comes into contact with the medicine. This is very important, especially for digestive, respiratory, and skin disease. Why? Because all these three segments, rasa is taste. There is something called rasa dhatu, that is rasa, first tissue among the 7 tissues in the body. So that is formed as the immediate result of digestion. So the first tissue formed immediately as a result of digestion has direct link with respiratory and skin dermatological systems. And the digestive system is the prior stage before it is being converted. So these 3 segments, this taste is very important. That's why we find that a patient who takes tamarind based food or tomato based food or strawberry, people develop very severe skin allergies due to strawberry. Some people develop certain drugs, they develop a fixed drug reaction. Even some drugs like semicarpus anacardium, they get immediately boils in the body. All this is because of how the taste, which has, of course, semicarpus anacardium, if it is not purified properly, it can cause allergic reactions. Because it's hot potency, it can cause. But on the whole, the taste can reflect into a problem in quick time in these 3 systems. Neuroendocrinological relevance is also being attributed to taste, neurological disorders, and then for diabetes especially. In diabetes, usually the medicine is usually tikta, that is bitter taste, or astringent taste. That is the choice of medicine. Most of the drugs, mostly it will be bitter taste. Whichever anti-diabetic plant which we are talking about, it will be bitter in taste. Now dosage form. The dosage can be churnam, that is powder, kashayam, that is decoction, or lehyam, that is a paste-like thing, and then thailam, that is oil. So the same drug, suppose I prepare ashwagandha, churnam, ashwagandha is there in many kashayam. It is not individually available as kashayam, but it is a part of various polyherbal kashayams in the market. Ashwagandha lehyam is very popular. Ashwagandha thailam is also popular. So all these four variants have different utilities because of the processing which being involved. Different utilities in the sense, either they have different disease indications, or in the same disease in different intensity it can be used. So ashwagandha lehyam comparatively has even more stronger or more promising action than ashwagandha churnam for improving vitality. And ashwagandha tailam is more stronger or more effective for neurological problems, improving muscle strength and neurological strength than ashwagandha churnam if it is being processed as thylam form. But one more thing is there. These four different variants are also decided because of the digestibility. So kashayam, the direct raw extract, we say the juice, swarasam, that is heavier to digest. And when the more the cooking, the more easier it is getting to get digested. Lehyam, because we are adding some more sugar, jaggery, it can be difficult to digest. That's why we find that in fever management, we find no reference about lehyam preparations. Why? Because digestibility is an issue there. And even a patient who has regained digestion after taking all the medicines for fever, he is expected to wait for some more time before going for any lehyam in case if he needs to take some lehyam. So different kinds of drugs based on the idea way in which it used, that is purificatory, which is used for vomiting therapy, for purgation, for enema. We are giving enema using by preparing kashayam and then adding with some oil and honey and then rock salt and then mixing it and then giving it as enema. So here it is not just a cleansing process. Enema is not just a cleansing procedure here. It has a therapeutic value apart from having local action. We say that vasti or enema is the ardha chikitsa, half of treatment as far as Ayurveda is concerned for various diseases. Even for eye diseases, even for diseases of the organs which are above the clavicle, there are enema procedures or enema formulations mentioned in the textbook. Pacification or palliative medicine, that's what we usually have discussed with in our clinical setting, because OPD practice involves more of this. So we call it as shamana chikitsa. And then health sustaining medicine, like we say, is it good to take this medicine for improving immunity? If it is good to take for this medicine for maintaining general strength. So people purchase over the counter. So those are categories under health sustaining medicine, provided they are having the safe track record. A diet article can be a medicine too. For example, mustard or this asafoetida. It is a diet article, but it has medicinal. For example, asafoetida is very good for relieving bloating. At the same time, a person with peptic ulcer should avoid asafoetida in diet, and also mustard. A patient with dry skin, he can include mustard oil in diet, provided he doesn't have acidity. So diet articles can be medicine too. A medicine become a diet article also. For example, pipali. Pipali is a very popular. Pipali rasam is given for people who have severe chest congestion, cough, COPD patients. On the day they take pipali rasam, they feel very good. Medicinal plants or the derivatives, though popular as home remedy, cannot be taken randomly. This is an important point which we have to reiterate. Because when we open newspapers or any media, electronic or print media, we find umpteen number of home remedies for diabetes. People say you take a lady's finger as kashayam, you take coriander seeds as kashayam, you take this plant decoction as kashayam, as a remedy, daily morning empty stomach. Have even heard people taking banana stem juice every day in the morning empty stomach. It is not right. It is not right to do that. It is not a must that all diet articles are safe for daily usage. That is also wrong. We have seen patients of irritable bowel syndrome because of everyday usage of green leaves. Some form of green leaf. Somebody has said in some program they have taken green leaf and they're developing irritable bowel syndrome, indigestion because of that. So even the textbook says pipali in diet is restricted beyond 7 days. As a medicine, the thing is different because we are giving a processed medicine. We have a dosage limit there. We have a purpose there. It is a prescribed product. But as a diet, pipali should not be used on a daily basis, even if it is used not beyond 7 days. Okay, coming to the current trend in terms of the finished products which we get in the market. Usually, in a traditional Ayurvedic practice, even in various Vaidyas who are there throughout the country, we find they give a coarse powder. They say you prepare kashayam, you take it every day. Now and then you prepare and then you discard it if it is spoiled. What we prepare in the morning, it may not be suitable to be used in the evening. It will have froth in it. It will smell slightly sour. The sour taste will be there. So it is there because in summer, most of the time it is summer, so it is likely to get spoiled. But to avoid all these constraints and to make the process of consuming the medicine easier, travel friendly, to make it portable, and also to avoid the taste aspect, because most of the kashayams are bitter in nature, to avoid that constraint, companies came forward to make kashayam in the form of a tablet. They prepare a kashayam, then they spray dry it, and then they convert into a powder form. Then they press it and then make new tablet. And then tea sachet form is also available. They prepare granules, they pack in a tea sachet, and then they concentrated powders they make, and they just you can just mix it with warm water and take. Like Ayush Kwath tea packets are available now. It's just an example. Some kashayams are available as granules form, directly mixed with water and consuming it. Sukshma Churnam, though it is a very minute, fine powder, still it needs to be boiled because it's not readily mixing in our experience. And then kashayam is available, prepared. It is prepared in big boilers in commercial setup, big industries, and then packed in a bottle by adding some preservative. So these are the various modifications as far as kashayam is concerned. Of course, the intent is to make it palatable, avoid bitter taste, and there is no difficult process of cooking it, and no need to carry a bottle, no need to fear that it's going to spill over. Just take a strip of tablet, carry it wherever you go, and take it with water. So kashayam tablet seems to be a much easier option among this list. But there are some views against it. They say that it escapes the very aspect of taste of medicine. As I said before, those three systems, it directly enters the stomach without coming into contact with the tongue, where the action through rasa, that is taste of the medicine, is missed. So that therapeutic role is missed. So there is another mode of using Ayurvedic drugs. It is not exactly a kashayam. Here what they do is the extract of plants is prepared through modern machinery, modern technology. Though it sounds to be different, same like because in 1:4, 1:16, 1:8, they have that kind of a ratio calculation. And then the extract is prepared. It is either an aqueous extract made into a liquid or a syrup, or the dry powder of the aqueous extract and then made into a capsule or a tablet. So they are effective, but not to the extent of kashayam, because the kashayam preparation, traditional kashayam, actually freshly prepared kashayam, is the best among all this. When it comes to churnam, the churnam is made into a churnam tablet these days. But the problem is both the churnam tablet and capsule do not achieve the 5-gram dose. They are effective in some cases, though, especially when it comes to conditions like acidity and then some kind of cough. In these conditions, for immediate relief, just this churnam tablet, if it happens to be a chewable form, if the taste is compatible for the patient, then you can expect some quicker action. Thailam. So Thailam, internally, Thailams are given in Ayurveda for various Vata-based disorders, neurological, musculoskeletal, etc. In those conditions, usually we give 10 drops empty stomach with milk or warm water. Now what they do is they pack it into a 600 mg or 500 mg or capsule, band seal capsule or hard gelatin capsule or soft gel capsule, and that is being given. It is effective also. We cannot say it is no. It is effective also. Externally, the Thailams are converted into ointments or bombs, gels, or even patches have become popular these days. There are patches not only for local action, but even for patches for stomach pain, abdomen colic, which are coming up. We don't know how far it's very effective, but we have just got the news about that. Arishtam Asam, the self-generated alcohol, they have not gone for any change. They have remained the same. They traditionally they're prepared, and it is always preferred to buy such Asava Arishtas in packed bottles, which are preferably glass bottles, because they say that this can interact with plastic PET bottle containers. That remains to be seen. We find that even PET bottle containers, Arishtasvas, are also effective, and we have not noticed any big change because of that. Ghee, Ghritam, again, it is available as Ghritam, or it is also modified into band seal capsules or hard or soft gel capsules packing. And then Vati, the pills which we roll traditionally by adding some ghee or some water or some liquid medium, and pills and herbo metallic. There are metallic preparations, the basmas or the sinduras, which are processed in herbs and then converted into tablets. They are available in tablet form. Chewables, chewables are available now. ODT, oral disintegration tablets are available. Strips, mouth melts are available, which are popular. These ashwagandha mouth melt has become popular. Even I find that they are registered as proprietary Ayurvedic medicine also, some of them. And then lozenges are also getting popular. We find some cough all lozenges are very popular. But there are challenges. So the biggest challenge in this is when it comes to, there are two aspects which I want to discuss. One, the traditional preparation. Traditional preparation, there is one particular example which I want to say. Some companies find it hard to avoid disintegration or breakage of the tablet in spite of packing it in strips. It is a traditional preparation. It is also told in the text to be made, the text says it has to be prepared into a bigger pill, big pill, but they may manage to make it into a small tablet form. But unfortunately, when you open the strip, it is completely falling down in powders. So these are all challenges which we face. When it comes to the modern proprietary medicine, like what we discussed, ODT or those lozenges, the proportion of the active drug versus the additives, that is the biggest problem here. So the novel dosage form, using technology, we want that drug benefit to reach a larger section, and the portability, easier way of consuming it. All these things can be achieved. But unfortunately, the additives and the excipients, they occupy 80%, 80 to 85%, remaining only is with the active portion, that is the actual drug. So the number of doses, the duration of intake, all the number of days the patient has to take, all these things are increasing. And unpredictability. The product stability issues like breakage, attraction of moisture, especially if it is a polyherbal combination. These things are faced very frequently. Now, as an Ayurvedic doctor, as a person who is also involved in formulation and also witnessing the problems we face, I have this question. Is it possible to predict stability using a consolidated physical property list being prepared of individual herbs in the drug? Just by, is it possible to do that? I just leave it to you for answering that question. So the drugs, whichever we discussed so far, the various plants which are made into different dosage forms, all these things are used for these modes of treatment. Either of these, or maybe some of them are used in many of these. The cleansing procedures, like as I said, emesis or purgation, we give as kashayam, or we give as powder with honey, or we give as a tablet also sometimes. Mostly for purgation, tablets are prescribed, powders are prescribed, and the layhams are prescribed. And nasal medication is used for not just for cleansing, but also it has other uses. But for in Panchakarma, nasal medication is used for cleansing purpose. And fumigation, we say that's dhumapana. Fumigation is done. And then applying medicine, the collyrium, the eyelids, that is also a part of a Panchakarma or an ancillary procedure to Panchakarma. And then venesection, various skin diseases, various other conditions, edema, localized edema, for all those conditions we can follow this bloodletting therapy or Rakta Mokshan, we say. We use a lancet, or we use a proper Rakta Mokshan tool for that. And then leech therapy is also a form of bloodletting therapy, which is being done for skin diseases, and even for some eye disease also by traditional Vaidyas. So for pacification or palliative medicine, we call as Shamana Chikitsa. We use the drugs for internal medication as well as external. As we discussed, we saw about powders or churnams. Churnams are popular for internal medicine, but many of us do not know that they can be used for external application also. Not just for local, not just for pain and swelling, but for skin conditions, for improving the complexion of the skin, texture of the skin, all those aspects also, external applications are there. And even there are certain external applications in the form of powder, which are applied over the scalp in combination with some swarasam or kashayam or some oil. And it is used to control BP, improve sleep. And also it is used for nervousness, stress management, so many other aspects. We call it as thalam. So different utilities are there. Parasurgical procedures in Ayurveda right now, like Agni Karma or cauterization, Kshara Karma using alkaline combination made into a thread. So that is used for managing fistula and other conditions like piles. And then rejuvenation. So ideally, rejuvenation is done after undergoing cleansing procedure, usually purgation. In OPD setup, we do that we give medicine to patient and then they go for the purgation at home, and then we start the rasayanam or rejuvenation procedure. And also an ideal diet and lifestyle combination is advised for rejuvenation. So these are the different facets of treatment for which we are using the different types of drugs which we discussed earlier. Now, this is a common question which is being asked. Can Ayurvedic doctor manage acute on chronic? Because we are not talking about acute disease, but there is a situation. A chronic disease, a chronic patient of rheumatoid arthritis can develop exacerbation of pain, relapse. So can that acute painful phase be managed through Ayurvedic medicine? So the Ayurvedic, we are able to manage pain up to a certain extent, but when it comes to many patients who have pain is something which is subjective, and the patient, if who is not able to get relief, they definitely go for some pain relief from modern side also. Whereas we continue to give the medicine for the main treatment. Our aspect, our medicines for conditions like rheumatoid arthritis, all these conditions, we give medicine for reducing the factors leading to that condition. For example, the markers in the blood, we look for ESR, we look for the proteins like antibodies which are coming down. These are all signs of our treatment proving to be helpful to the patient. But any change in climate, or it become suddenly a rainy weather, or suddenly the patient has not gone for proper diet advice, has not followed the diet advice, then this exacerbation can happen. And in that situation, the result has been mixed. Sometimes in some patients we are getting good result, and in some patients they are forced to go for modern pain relievers for that time alone. Severe itching, in case of urticaria, in case of dermatitis, most of the conditions of itching, severe itching, we are able to manage. A purgation is really, a simple purgation is helpful in those cases. In some conditions, even vomiting therapy is being done. Acute diarrhea, here also we are able to get good result. About 75 to 80% we are able to get good result. We can expect the diarrhea to get arrested within 2 to 3 doses. Within that particular day, the patient can feel the difference. Fever, again, this is the area which many of us as practitioners and also people who manage fever in children, we face this situation. So fever management, it is also a mixed area where we are able to get good results in adults, but in children, because of the challenges related to waiting period and also the suspicion about other threats related to fever or fever causing other complications, we are not able to get good result immediately, good result on a statistically convincing scale in children for fever. Cough and asthma, cough management, dry cough management in this corona period, we all would have heard about this, how effective Ayurveda has been for managing cough because many people who took treatment face a fever and other conditions, they got admitted, but after even getting discharged, they had cough continuing for them, and we were able to manage that. Asthma, of course, acute asthma is again a challenging condition for Ayurveda also, but in acute phase, the success rate is maybe 30 to 35%. But in chronic asthma patients, the incidence of the repeated episodes of asthma can be prevented convincingly through Ayurvedic treatment. Headache, as I discussed before, migraine headaches, other parenteral route procedures like applying thalam and all those things are helpful. Even for sinusitis, sinus headache, applying some paste like Rasnadi Chewandam, all these things are helpful. Burning micturition, the result is good. We are able to give good result in quick time. So based on the platform which we are discussing, an integration between Ayurveda and modern sciences like pharmaceutical sciences is definitely essential to work towards a larger goal of health for all. So with that, I conclude. Thank you all for your patient listening.
Sir, thank you, Harikrishnan, sir. It's a great privilege, sir, to heard about this type of things in the Ayurveda. As we all the domain of the pharmacognosy, we are having learned up to some extent, but practical approach, we are unknown and we are unawareness. By seeing your all these things, we are getting some awareness and we learned something from this, sir.
Thank you, sir.
Sir, I'm having small query, sir. Regarding the chronic diseases means the psoriasis can be considered as a chronic, sir?
Yeah, chronic.
Which is an autoimmune disorder.
Yeah.
Is there any permanent cure is there, sir, in the Ayurveda?
Psoriasis, no permanent cure is there. We can give relief. It all depends subjectively also. In some patients, you find only scalp and palmoplantar psoriasis. There, it's not a big deal. Even in people who have psoriasis in their trunk also, in some areas, if they have, we can give relief. But if it is widespread and if it is chronic, then we can give relief only up to a certain extent. There also remission and relapse, it keeps happening in autoimmune as other conditions, like other autoimmune conditions. But we can prevent it by doing some cleansing procedures. Masi Virachanam. Every month they have to go for some purgation, cleansing the. So that can help in, and also they don't stick to the diet. That's a basic problem. Avoiding sour food, avoiding non-vegetarian food, especially fish, that can give good result in people who are suffering from psoriasis.
Actually, one of our relative is having psoriasis with arthritis, sir.
Psoriatic arthritis, okay.
Okay. So for that reason, and actually they previously they went for the treatment of Ayurveda as well as allopathic also. Okay. But now they're not relying on the medication, they're relying mainly on the food intakes and some type of dietary things.
And the food intake, if they're very careful about food, even some climate changes also they won't be affected much. But in spite of that, people get affected. If arthritis pain is there, skin will not be there. Skin problem will not be there. If skin problem comes to the fore, arthritis pain will reduce. So it is a cycle. Some patients I find both together. That is very severe to handle, very tough to handle. But definitely they need relief, and we can give relief to some extent.
Okay. So based on the periodically based upon the climatic conditions, it may become reverse the thing.
Yeah. So in rainy season, psoriasis will be actually commonly it is very it is common to see that aggravating in winter, dry, cold weather. There are summer variants also, but winter is very common.
Okay.
When it comes to pain, psoriatic arthritis, when it is raining during winter and other rainy seasons, then the pain will be very severe. So we can see some pattern in that. In Ayurvedically also, Vata related issue in Rakta, that is blood related problem, you find pain coming to the fore. If Vata is getting to the skin and muscle tissue, then we find skin issues.
Any long-term treatment is required, sir? The lifetime
for psoriatic arthritis, long-term treatment definitely is needed. At least to find the efficacy of one. Suppose a patient may come today, they don't have any symptom, but they have history of this remission and relapse last 3 years. So it is good to take them, give them some treatment now itself, so that they don't face the same problem of relapse like before. The intensity will be definitely lesser than before. So that one. Other categories, they have symptoms when they come to us as patient. For them, we give some extensive treatment. We give cleansing procedures also. For psoriatic arthritis, definitely enema is also needed. Many patients need admission actually. In OPD level, unfortunately, the decision to go for IPD treatment is not taken very easily by patients. They take very few only go for that. Out of 100 only 20 go for that. Remaining, they prefer to stay at home and take some treatment. So that's where we are not able to give results.
Okay, sir. Fine, sir. Any queries from the participants? Sir is ready to share his views on your queries. Please, if you have any query, unmute yourself and you can express your view.
Dr. Hari?
Yes, ma'am.
Yeah, so that was through the presentation. Yeah, I had a small issue about, I'm Dr. Mangathayaru, one of the resource persons. So
Yeah.
We know we are in. You were talking about fever. Ayurveda is not very up to mark in handling fever, especially in young children. That's
No,
very true, correct. Actually,
yeah.
from my experience, I have a question. Like for my grandchild, now when she had very 1+ year fever of unknown etiology, she was hospitalized. So that time, one doctor from like an Ayurvedic doctor from Isha suggested Rasnadi Churnam to be applied on the head. It really did work very well, and usually for her, fever does not respond to paracetamol. Other she had to be given anti-inflammatories.
Okay.
But this Rasnadi Churnam really did miracle when she was in the hospital and the temperature came down drastically and her fever was responding to paracetamol. So I was thinking Rasnadi Churnam is a miracle drug.
Yeah,
Does it
good.
apply to all patients, right? Maybe
Yeah,
it worked for
definitely.
her.
It's very effective in sinus headache and sinus congestion, and also fever with sinusitis. Definitely, it's going to help.
So it cannot be universally applicable to all patients. Is
It
that
can be
right?
applied for all. It's safe for all. It's not going to cause any skin reaction. Also, the combination
Maybe
is not that.
maybe she was a young child, that's why it worked. For us, if we have fever, we cannot apply Rasnadi Churnam.
So we can apply, madam. If heaviness of the head is there, we can apply. Maybe the fever, the cause of the fever in her case was related to sinus. I don't know whether we have to see that.
Oh,
Maybe,
okay.
no, that.
So it's not like paracetamol, cannot be taken by all.
No, it's not.
That's what you're
It's
saying.
not directly indicated for fever. Maybe the cause is related to that particular segment. And Rasnadi is also used for pain relief, even muscle spasm, joint pain and swelling. Also, it is used.
Yeah. Okay, so the bottom line is we cannot have one drug for all. It's subjective once again, patient.
Yeah, the first cause comes in the list. Next is the patient-centric decision.
Yeah, right. Thank you.
Pandashri madam.
Sir, I would like to ask one small query, sir. Sir, can you highlight the importance of Panchakarma in lifestyle disorders, sir?
Yes, ma'am. See, Panchakarma in lifestyle disorders. Actually, diabetes is a lifestyle disorder, but Ayurveda prohibits the use of strong Panchakarma procedures in patients who are losing weight due to diabetes in that category. But when a patient has a metabolic syndrome, when the patient has kapha prakriti, in those patients we can definitely go for Panchakarma procedures. Only thing is, the prerequisite procedure for Panchakarma is sweating therapy. We call it as Vedana, but that cannot be done extensively in diabetes patients. But in obesity, definitely we are doing a lot of Panchakarma procedures like Udvartana, that is reverse powder therapy, powder application, and then sweating therapy, then Virechanam, that is purgation, then enema. These things are done in Snehapana is done. First of all, Snehapana is very popular for people. Don't expect this because people say, why are you giving ghee for a obese patient? But actually, some ghees are effective in reducing weight. It's because ghee has one particular property. It imbibes the property of whatever it is processed with, whichever medicine it is processed. It imbibes that property. That is, we say Gunanta Radhanam, which means it takes up the property of that particular thing. So this particular ghee called as Gokulatiktakam, it's a ghee which is containing mostly bitter medicines. Bitter principle helps in losing weight actually, and also cooking all the unwanted indigested things in the body, and also eliminating the toxins from the body. And this particular ghee is very effective. Snehapana means giving medicine in the form of ghee or oil on a large scale, say 50 ml, 60 ml, something like that. And there's no food for the patient. They take, if at all they are hungry, they are given only a sip of kanji or something, but they should not take any food at all. This is done for 3 to 7 days based on the patient's capacity. And that is also proving to be helpful in losing weight in obesity. But it is obesity, diabetes. Apart from that, cardiovascular disorders, people who are already having problem taking medicines for cardiac conditions, we don't do extensive Panchakarma procedures. Other, see, the patients which we get in cardiovascular categories, they get knee pain. For that, they come to us. But for cardiac conditions, they take modern medicine. For them, they ask what can you do for us to lose weight? Because the doctors suggest to go for a walk. For them, we do only palliative medicine. We don't do extensive Panchakarma procedures for them. So lifestyle disorder, stress, we do, of course, a lot of procedures like Abhyangam, that is massage and Shirovasti, Shirodhara. Then plain application of people, most of us don't apply hair oil every day. That is the main reason for stress and hair fall. If we do that, then stress will also come down. Very simple thing. But even then, if they are not getting result, then we go for Panchakarma procedures.
Thank you, sir.
Yeah.
And you have covered every corner of Ayurveda and given a lot of information about various diseases, sir.
Thank
And
you.
basically, the root cause treatment is main important in the disease cure.
Yes.
Many systems of medicine mainly concentrate on the symptom, but the root cause is left. Unless we treat the root cause, the disease will not be permanently cured. So
Yeah,
you have
that's sure.
highlighted several aspects related to more health issues and how we consider health only when the body, mind, and soul are healthy. Then only human being will be healthy. And definitely, sir, in combination with pharmacy, Ayurveda can do a number of innovative works, sir. We are
Definitely, ma'am.
for collaboration with you, sir, in near future.
Sure, ma'am. I'm happy to do that. Thank you.
Thank you very much,
Thank
sir.
you. Thank you all. Thank you. Thank you.
Sir, thank you for your time.
Thank you, sir, for your time being and
Yes.
can provide me a good awareness regarding the Ayurveda as a
Yeah,
madam.
I thank the organizers. I thank the college management and everyone for giving this opportunity to share with you about Ayurveda. Pleasure meeting you also. Thank you.
Yes. Sure. Thank you, sir. Dear participants, we have posted the attendance link also. Please all of you fill, and we have provided in the WhatsApp group as well as in the Zoom link also, and try to fill the form before 1 p.m. Okay. Thank you one and all, and the session is ended. So all of you can leave the session. Thank you once again, Hare Krishna, sir.
Thank you.
Thank you, sir. Thank you.
Thank you. Namaste.